The NIHR Biomedical Research Centre is committed to supporting an extended repertoire of allied health professionals. These include nurses and midwives, physiotherapists, dietitians, and pharmacists. These health professionals find it particularly challenging to take time out of their busy schedules and undertake a period of dedicated research. Joining me today is Dr. Jig Patel, Honorary Consultant Pharmacist and Clinical Senior Lecturer at King's College London. Jig, tell me about your journey from clinical pharmacist to PhD student.
So I qualified as a pharmacist in 1997, which is some time ago now, and I did the usual sort of rotational work that a junior pharmacist would do in a number of hospitals in southeast London and the south coast. And then I took a position in anticoagulant therapy in Brighton before moving back to London to do some work in one of the London hospitals in anticoagulant therapy. As well as doing some work at King's College London, doing some teaching for undergraduate students. And it was during that time that I wanted to do some research, really, clinical research, that would have an impact on patient care. So that's when I spoke to my boss to see if there was an opportunity. I had a research idea in mind, but at that time, I didn't know how to go about getting funding to do the research, particularly in our field where we don't have a traditional sort of career path which leads to a research career.
So it's difficult for people like yourself to actually find research opportunities and funding?
Yeah, it's not as well defined, I would say, as perhaps a medical career. Yeah.
So you undertook a 3-year PhD?
Yes, yeah.
So what was the impact of that on your career and subsequent events?
It's been amazing, actually. I've absolutely loved it. At the time when I was applying for the funding, I knew that that's what I wanted to do. And because the research idea was something that I came up with myself, it was great to be given the opportunity to do the research and then see its impact on patient care. So the impact it's had on my own career has been great, because following the completion of the research, I've taken up a clinical academic position between King's College London in the Institute of Pharmaceutical Science.
And your area of interest and expertise was what particularly at that point?
It was anticoagulation therapy. So I'm based at KCL, and then also at the Department of Haematology at King's College Hospital.
So how would you see that academic track differ from that if you had not decided to take the research route?
A full-time research position. I think I've always enjoyed patient care, and I wouldn't want to lose that. So half of my time now, I do still continue to provide a clinical service, but I use that as a foundation for my research activity. So I get to do both, which I think is great. And because the slant of my research activity is very much with that patient focus in mind and seeing it translate into those patients, I think it's great to do both.
Because of your own experience, presumably you've had opportunities to influence young clinical pharmacists coming through who've expressed an interest in doing research?
Yes, because of the BRC funding schemes which are now available, I've supervised 2 MRes students, one from Guy's and St Thomas's and one from King's College Hospital, over the last couple of years. And recently we applied for some funding from Bayer for a studentship, and that was successful as well. And that's seen a pharmacist from Guy's and St Thomas's come up to take up that PhD position.
Finally, let me ask you, what would you see as the biggest challenges juggling clinical service and academic research?
I think the biggest challenge is just the time commitments, because you end up doing two roles, and sometimes there doesn't seem to be enough hours in the day. But I think if you marry up the research with the clinical service, then that seems to work quite well, and certainly works for me. And that's, I guess, my philosophy. I try to do research in the clinical area I work in, and that works well.
Very good. Thank you, Jig, for telling us about your research career to date.
Oh, no worries.
Thank you.
Thank you.
Compared to other clinical trainees, opportunities for allied healthcare professionals to undertake research are far more limiting. We believe that those Schemes provided by the Biomedical Research Centre provide great opportunities for trainees to use their clinical expertise to undertake a period of research that will in the longer term benefit patients.